coming up from the Northeast Live Studios in Guwahati. Northeast Tonight with Wasbir Hussain.
Hello and welcome to Northeast Tonight, the show that decodes the region. Finally, we have a date, viewers. India's coronavirus vaccination drive will begin on the 16th of January. Priority would be given to around 1 crore healthcare workers and 2 crore frontline staff like doctors, community health workers and police personnel. The next in the priority list will be people over 50 years of age, followed by those under 50 but with comorbidities. In the first phase, an estimated 30 crore people could be vaccinated throughout the country. Along with the rest of the country, Assam too is all set with the COVID vaccine rollout plan. It's a huge phase-wise exercise in which nearly 20,000 health workers, including 9,000 vaccinators, will be involved in administering the vaccine, first to priority segments like healthcare workers. Assam currently has a capacity to store nearly 4 lakh doses of vaccines of all types, not just COVID vaccine. That comes to roughly 1.25 lakh liters. The elaborate COVID vaccine rollout exercise will see the vaccine vials first getting stored at the state vaccine store, which is a huge walk-in cooler in Guwahati. Then they would be transported to the 5 regional vaccine stores, then of course to the 27 district vaccine stores, and subsequently they would be taken for storage at the 723 cold chain points across the state. From these cold chain points, the vials will be taken out for administration to the recipients. In the first phase, Assam is expecting between 5 to 10 lakh doses. Several questions come to the fore. Assam has already been recognized by the central government as a state that was able to manage the COVID pandemic very well. Northeast Live would also like to join the rest of the people in congratulating every healthcare personnel in Assam, from the health minister down to the ward boy in the hospitals. The big question now is, by when will Assam be able to inoculate all its residents? Remember, we are a state with a population of 35 million or 3.5 crore. Can we sit back and relax on our healthcare infrastructure, or can we be happy at the current strength of our total healthcare workforce across Assam? Do we need more facilities and manpower, and if so, what do we really need? Now that the vaccination would start soon, can even those who are not inoculated in the early phases get indirect benefit against COVID? What about efficacy of these vaccines? To discuss and get answers to many of these questions, I have a very eminent panel tonight. I am joined by Dr. Lakshmanan S., Mission Director, National Health Mission, Assam. Also with me is Dr. Achyut Baishya, Principal, Guwahati Medical College Hospital. From Newcastle in the United Kingdom, I am joined by Dr. Jayanta Sharma, a lead consultant microbiologist at the National Health Service of the United Kingdom. And also at the studios with me is Dr. Madhumita Priyadarshini Das, Professor of Medicine at the Guwahati Medical College Hospital. Ladies and gentlemen, welcome to Northeast Tonight. Let me go straight to you, Dr. Lakshmanan, Mission Director of the National Health Mission. You are an extremely busy man. Thanks very much for sparing time and joining this discussion, which is absolutely in public interest and nothing else. First of all, Dr. Lakshmanan, we have heard the Prime Minister reviewed the situation today, and then the dates came out. The India's vaccination drive against coronavirus will begin on the 16th of January. It's a massive exercise. How is Assam prepared to be part of this nationwide vaccination drive from the 16th of January?
First of all, it is indeed a very, very good news for a large population, the whole India, the whole country, that India, like many other countries in the world, leading countries in the world, including European countries, UK, US, China, we are also heading towards initiation of vaccination against COVID. This has been a very, very tremendous achievement if we consider that probably we got less than 10 months to develop a vaccine, to prepare, to deliver the vaccine as well. And I should say that lot of credit and congratulations goes to each and every scientist working behind this great effort, as well as the administration, the government, for giving such a good leadership, a tremendous leadership indeed, to prepare the whole country for such a vaccination. At the same time, the state government under Honorable Chief Minister Sir, Honorable Health Minister Sir, had been reviewing each and every step for our preparation through different video conferences with Government of India, different districts, and within the organizations as well. State level steering committee under Chief Secretary, state level task force under Principal Secretary, different district level task forces have been preparing over a period of last 2 months for getting each and every point related to vaccination to be absolutely prepared on any day the vaccine is being launched. Now, we have got a date in front of us, that is 16th of January.
Right.
Naturally, we are looking forward with all preparations on place, so that along with the country, we will be in a good position to start vaccination among the healthcare workers as the first priority from the date of 16th.
Okay, we'll expand on the entire logistics. It's not an easy operation. As I have said right at the beginning, in Assam, 20,000 healthcare workers will be involved in this entire exercise of administering the vaccine. This includes 9,000 vaccinators. We'll hear more on this from Dr. Lakshmanan. Let me start with the opening remarks. Let me go to you, Dr. Achyut Baishya, the principal of the Guwahati Medical College Hospital, another extremely busy man. Thank you very much also for being on the show. This vaccine, now everybody was, the moment COVID started, the moment the world realized that we are facing a virus about which we did not know anything, everybody was thinking, when is the vaccine going to come? Finally, the vaccine has come, and as far as India is concerned, as Dr. Lakshmanan has said, we have a date in front of us. Now, how are you going to begin? What thoughts cross your mind as a medical practitioner? What do you have to say?
First of all, this is a very good news that when the COVID started, then we thought that in the next year when we started the fighting in January, February, then we were thinking that until these medicines against the virus is coming or the vaccine to boost the protection of the immunity of the persons are coming, so we are just only fighting the symptoms. So then the focus was on only the treatment. Then we categorize the people, the high risk. Then again the severe cases we are needing this ICU, etc. But when the hope of this vaccine came, and now it is a reality now, so definitely it is a really encouraging for all healthcare professionals that now we can get rid of COVID-19 by vaccinating suppose we vaccinated first our healthcare workers who are dealing, and if you see this epidemiology of the infected people, then you will see that most of the infected people, when I started in Guwahati Medical College, I started in June, then first lot I faced that every day my 10 nurses, 5 doctors, 5 cleaners. That means in COVID there are 2 sets. One is on axial duty and another is the reserve. That means in quarantine. So to run a ward, it is very simple that only 3 people are required.
Right.
But to run it, I need 6 people. And if somebody is sick of these 6 people, again another extra, that 25% extra. So it is a huge task for us, particularly in the healthcare managers. But when this vaccine is coming, this is a ray of hope that at least we will get rid of. And now, fortunately, in Assam, the infection rate is coming around 0.2, 0.1 like this.
Right.
But still, the until and unless the treatment, specific treatment by any antiviral drugs are available, it is still not available. All we are trying are only some for these different antiviral drugs we are using. But now the COVID vaccine is coming.
So vaccine you are depending a lot on the vaccine, at least to protect the first responders who are the healthcare workers. Absolutely. Yeah. I'm coming back to you, Dr. Baishya. Let me go to you before. I'll come to Dr. Jayanta Sharma last in this opening round, because I want to take a perspective from the United Kingdom, one of the worst hit countries in the world as far as COVID-19 is concerned. Dr. Madhumita Pidas, a lot of people are asking, okay, vaccine is coming, very good. Suppose a lot of people in Assam will take the vaccine now. What is the efficacy of these vaccines? Can people who take the shots, do whatever they feel like and forget about the protocols and so on and so forth? What do you have to say?
That's a wonderful question that you have put forward, Wasbir. One thing we should realize, that no vaccine in this world is 100% protection against any disease, be it poliomyelitis, be it measles, mumps, rubella, whatever vaccines that we have till date. There have been instances of people contacting that particular disease after having taken the right shot at the right time.
Right.
So it is with the COVID vaccine. And we have two vaccines that have been rolled out in our country. They are the Covishield and the Covaxin, and both of them are supposed to be 70% efficacious as far as the disease protection is concerned. So it's only time that's going to prove that whatever has been said is 100% correct, or it's going to be even more efficacious. So we are yet to roll out and yet to prove what we collect as data after the vaccine is rolled. But till now,
but you are hopeful. But yes, you are hopeful.
Absolutely.
Even 70% efficacy is not a ordinary thing at this stage when the world has been grappling, isn't it?
Absolutely not. We are very optimistic that that's how we can protect the people in the long run.
Right. Now, Dr. Jayanta Sharma, I'm coming back to you, Dr. Lakshmanan. Let me go to the United Kingdom, Newcastle. That is where Dr. Jayanta Sharma is joining us from. Dr. Jayanta Sharma, United Kingdom is considered to be among the advanced countries in the world. United Kingdom has taken a very bad hit due to COVID. Even today, the daily rate is about 60,000 plus who are getting affected by COVID on a daily basis, 50,000 plus 60,000. So the vaccines have already started in the United Kingdom. Now, considering that India, we have also followed suit very, very quickly compared to what in the United States we have followed the UK, and now India is among the largest countries which has going to start the vaccine. How do you look at this development, and how do you compare very, very briefly, because this is the opening round?
Okay, I mean, India is in a very good situation timing-wise, because, I mean, by now we know that this is a seasonal disease. And for India, I think COVID cases are going to increase when it comes to May, June time. So India got a big, kind of good few months actually to vaccinate the vulnerable population as quickly as possible. So timing-wise, India is in a very, very opportune situation, to be honest. As far as situation in United Kingdom goes, I mean, as of today, average cases in the UK is 600 per 100,000 population. So that comes to 0.6%. That is a national average. And where I am living at the moment in Newcastle, it's half of the national average. And my workplace is actually not Newcastle. I actually work in Mid Yorkshire, where we are below in Mid Yorkshire, we are below national average as well. But in London, certain areas in southeast of England, I mean, cases are approaching like 1%, like 1,000 per 1 lakh population. But don't get alarmed. Don't get alarmed. Don't get alarmed at all, because let me quickly explain. At the height of the epidemic in April, in March, what we call first wave, but these waves are misnomer. I'm not going into that. During the March, April, we had a daily case numbers of about 5,000 to 6,000 average. And today we are having 60,000. But where it is 12 times. Yeah. But where is the hospitalization? Is hospitalization 12%, 12 times? No. It is barely, we are just gone above in terms of hospitalization what it was in March or April. So what does it tell you? Yes, we are getting a lot of infections, but we are not getting diseases. We have to make a distinction between infection and diseases. That is fundamental in infectious diseases. Infection doesn't equate to disease. We should be more concerned about diseases, the hospitalization.
Yeah.
The more we panic by spreading these numbers,
Right.
we are not coming to our sense when it comes to tackling this problem. There is immense damages already caused, collateral damages. So I think perspective is the key, and here I admit there are many perspectives. There is
Okay,
not one perspective
we will talk. We will take some of these perspectives. I'll come back to you, Dr. Lakshmanan. I have said in my introductory remark, but people would like to hear from the horse's mouth. And you are the person who is, heading the National Health Mission in Assam. Can we have that chart? Now the 16th of January is the date when the vaccines are going to be given. Now I have got a few basic questions, very, very basic questions. Does Assam already have the stock? If it comes, where is it going to be stored? How many people are going to be involved? And of course, you have had already 3 dry runs and you are absolutely prepared. Can you explain briefly how is it going to happen? Can we increase the size of that graphics, please? Let's have Lakshmanan on the screen. Yes, please.
Yeah, first of all, let me say it very clearly that in the last 3 dry runs, one happened on 28th and 29th of December in 2 districts, Shonitpur and Nalbari. Subsequently, we had a second dry run in Kamrup Metro covering Guwahati Medical College, Sonapur District Hospital, etc. And on 8th, that is yesterday, we had covered all the 33 districts of Assam with varying number of institutions, 3 to 4 institutions per district. And in the last 3 dry runs, we have learned how we can actually plan, prepare and administer the vaccine when it is available. So that is regarding the preparatory part.
Right.
Next comes the question whether Assam has received their vaccine, our vaccine as on date. No, as on date we are still waiting to get the vaccine, but we are absolutely prepared to receive the vaccine, store it and transport it wherever we are planning to have our vaccination session sites on 16th of January. Now coming to the related logistics, including the trained healthcare workers who will be the first vaccinators, then the beneficiaries who are going to get the vaccine, that again is another set of healthcare workers only, and how we will be delivering this thing. At present, as already mentioned by our allied panelists, 2 vaccines have been given emergency use approval in the country by the concerned authority DGCA. Now, these 2 vaccines are being produced in India, and according to the availability, any one of these vaccines will be allocated to our state. Second, now these vaccines when they are coming, there will be clear instructions how to administer this vaccine. Mostly intramuscular injections will be given, and what will be the duration between the first and second dose as well. And lastly, India fortunately, especially our northeastern states, have a huge experience as far as immunization is concerned. Dr. Achyut Baishya, Principal GMCH, would further explain that Assam as well as country has been tremendously performing as far as immunization is concerned. We have one of the largest immunization program across the country, and irrespective of the ages, I may say, most of our immunization belongs to children, but still we have absolutely good experience regarding adult vaccination as well. We have had Japanese encephalitis vaccination, and of course we are vaccinating every pregnant woman for TT and all. Hence, we have good experience, very good infrastructure and a set of dedicated healthcare workers who would be walking the last mile to deliver this vaccination.
Now, Dr. Lakshmanan, these vaccines are going to reach every state. Let's talk about Assam. Are they going to come by air, special flights, or how is it going to come? By what mode of transport?
Obviously, Government of India has taken up with different aviation industry participants, and
so it will be basically what you are saying. It will be flown in.
Yes.
So it will be flown in. Viewers, that is the story, because you'd like to know every detail. Viewers are curiously waiting to know every single detail. That 16 January is the date. Assam has not yet not yet got its first stock of vaccines. It is going to come soon, well in time, so that it can be rolled out. And Dr. Lakshmanan has just said that it's going to come. It's going to be flown in, perhaps in special planes. The vials are going to come, and as I have said, it will be stored in the state vaccine store, which is a large facility, before going out to the districts and then of course to the cold chain points. Let me come to you, Dr. Achyut Baishya. As Dr. Lakshmanan said, Assam has a very good experience as far as vaccines are concerned. But let's talk about the COVID vaccine now. Is there excitement? Suppose you are heading the biggest hospital in the entire northeastern region, the Guwahati Medical College and Hospital. That was initially, when the COVID started, that was the nerve center of activity, where you got the tested, where you got the facility to test, etc. So considering all this, is there excitement? How excited are your own healthcare workers who are working with you?
Definitely. This is the first vaccine in a Covaxin where we are running dry run. So definitely all are excited. What is going to happen? Because if you see, in the last, we are involved, particularly we are involved almost in many of the campaigns last 10 to 15 years. We conducted the adult JE vaccine in many of the districts very efficiently. Then we completed the measles campaign.
Right.
We completed the rotavirus campaign. This campaign, even this pulse polio, we are running from 1995. Our healthcare workers or frontline workers are efficiently working, and Assam is doing well in the immunization coverage. And regarding this vaccine, the workers, particularly health workers, you are asking a right question. Yes, they are excited, because for the first time, I am asking the doctors also to be volunteers how to run a dry run for the vaccination.
Yeah.
This dry run, if giving them the vaccinators, the managers are giving the exercise that who will come at what time. This is in sequence. They will be called from the app. They will be called, and they will be given the space to sit, and in this space they will wait for their turn to come. So it is not a huge crowd will be called at a time. These all will be in sequence, and they. Even in dry run, a vaccinator is taking his own time to ask this client to remove his shirt, remove his dress, then how many times he will need to remove his shirt, how many times he will.
Everything is worked out.
Everything is worked out.
After
that, all the information is a dummy information, but
right.
Still, for all the informations are entered in the format, and in the format it is correctly or not incorrectly. Already it is being tested.
No.
That means all the health workers working in this Covaxin or this Covishield, whatever the vaccine will come, is excited that when the real vaccine will come, because their job.
And you already know how much time it is going to take, right from the person coming and sitting in the chair to the time he leaves the place. I have few basic questions to you, Dr. Lakshmanan, before I come to the other two panelists. How do I know that when my vaccination turn will come? Do I have to register as a common man? Do they have any role to go somewhere and register that I want to take the vaccine, or is it going to come to them automatically? They are going to get a call.
This is one major change, a major improvement, I should say, about COVID vaccination. All our normal vaccination programs have a facility where the beneficiary can simply walk in to a center, whether it is a PHC or a sub-center or a community health center, to get vaccinated. However, in case of COVID vaccination, the government rightly have taken a decision that here each and every beneficiary will be a registered person to receive the vaccine. The registered beneficiary will be given information in advance that so and so center is waiting for your vaccination. You can come to this location on such and such date with an identity card proving your identity, so that when you reach the vaccination session site, there is no kind of confusion.
Right. Now, who has registered them? Have they got themselves registered, or automatically you are following some electoral role, or
Yeah.
how are you registering them?
First of all, as the whole government has planned for priority vaccination of healthcare workers, for this purpose alone, a portal called CoWIN,
Yeah.
COWIN, CoWIN portal has been developed by Government of India with the help of UNDP and other development partners. In this portal, earlier we already in Assam we had a portal called EVIN, that is Electronic Vaccine Information Network.
Yeah.
Now this has been modified for CoWIN. In this portal itself, the health department have entered the name, identity numbers, phone numbers,
Okay.
age, and everything of these beneficiaries. This is for the healthcare workers.
Healthcare workers.
In future, there will be definitely modifications so that people can come and even self-register.
Now the government has also said that in the priority list is people above 50 years and people below 50 years but with comorbidities. Now, what about these people?
Exactly.
How are the names included?
Yeah. At this point of time, we have a dedicated information system for the healthcare workers. So, from the health department, we have been uploading their names. Similarly, for frontline workers, different departments in state government as well as government of India, for example,
They will give the names.
railways, etc., railways, then even state home department, they are uploading the names of their beneficiaries.
What about the common man?
Yeah, that is why. In the next phase, that is the people who are above 50 years and those people who are less than 50 years but having some comorbidities, the Government of India is working upon improving the portal where self-registration facilities will be coming up phase-wise. But on 16th, where we are thinking about the first date of COVID vaccination in India, we are looking forward absolutely for healthcare workers as the first line. And let us not forget that at this point of time, we are planning for vaccination with emergency use approval for these two vaccines in the country.
No, absolutely. Now, before I'll go to Dr. Jayanta Sharma and Dr. Madhumita P. Das, but one last question to you in this round, Dr. Lakshmanan. What is the figure of the healthcare workers in Assam, total figure and the first phase?
In the first phase, we are taking up approximately 1.7 lakh healthcare workers already registered in the CoWIN portal. We have already taken their details. They have been given the information as well. Once we roll out the vaccination, each one of them over a period of time will be given clear information on what day, at what location they are supposed to approach.
Okay, for viewers, this is the story on the 16th of January when the vaccine rolls out in Assam along with the rest of the country. First recipients will be 1,07,000. 70.
Yeah,
1,70,000, sorry, 1,70,000 healthcare workers who have already been listed. This is what is going to, they are going to be the first recipients. Of course, they cannot be administered on day one. It will take a few days for that to happen. Dr. Jayanta Sharma, one question, I'll have to go for a break very quickly. One question which everybody wants to know, you know, once the COVID vaccine rolls out, obviously it's going to happen in phases. Can those people who are not vaccinated, can they also hope to get some kind of indirect benefit? A lot of people are saying that those who are vaccinated will help in breaking the chain. So, is this another indirect benefit of the vaccine?
Of course, I mean, you have to count the persons who are already infected as well as if they were vaccinated. So combining the new vaccine, people who are going to get the vaccines, plus the people who are already infected,
right?
I think that is the key number. They all are going to contribute to the breaking the chain of infection. We call about herd immunity. I don't want to go into detail, but approximately when you say that 60-70% of the people are immune, then the chain of transmission is essentially can be broken. So yes, to answer to your question, is there? Yes, people would get indirect benefit, those who are not getting vaccination in the first round.
Absolutely. Now, Dr. Madhumita, the estimate given by the authorities, the central government authorities today is that in the first phase, 30 crore people across the country are going to be vaccinated. Now, 30 crore people, if you look at the overall population of India, it is almost one-fourth of India's population. That itself it is a cause for cheer.
Absolutely, Wasbir, as Jayanta just said, because you have to count the people who already have been infected and are probably harboring the antibodies against the virus. So they are a huge contributor to the population who are immune to the COVID virus. Plus now you're going to vaccinate 1/4 of the population. So 1/4 plus whatever number of people who are with the antibodies will contribute towards what is called the herd immunity, as he has just mentioned, because once we have about 70% of the people vaccinated or infected and immune, then we achieve a state where the disease is almost completely, under control.
Yeah.
COVID is not perhaps going to leave us. It's something going to be like tuberculosis, maybe. Some people will be suffering now and then, but it's not going to be a pandemic ever again.
Absolutely, absolutely. We are getting very, very valuable inputs from our esteemed panelists. I'll go for a very short break. When I come back, I will talk to Dr. Lakshmanan and Dr. Achyut Baishya about, how Assam is actually going to inoculate or immunize or vaccinate the entire population, how much time it may take. We'll try to get a feel, try to get some idea on this entire exercise from there. Don't go away. I'll be right back. Welcome back. Let me once again go to Dr. Lakshmanan. Dr. Lakshmanan, you see, now the vials are going to come. You are going to administer the vaccine. The question now is, what has this COVID, as far as the pandemic is concerned, the last 10 months, the Assam government worked overtime, particularly health department worked overtime to take even students as, recruited even students to deal with the situation, come up with fast track infrastructure. Now you are fast tracking everything as far as COVID vaccination drive is concerned, training of people and so on and so forth. So what has this taught you? How well you are equipped? Can we sit back and relax, or still you have a lot to go?
Definitely, this is not a situation that we can simply cheer that the vaccine is out and we can just throw away all safety measures we have done so far, because that will give up whatever achievement we have made within the pandemic time. Let us not forget that COVID pandemic or COVID infection is still there. It is still potent to get the infection from one person to another. In fact, in the last 1 month or so, the world has witnessed newer strains coming into the fore. Even then, let us also not just forget the situation what was there maybe 6, 7, 8 months back. As a proud citizen of the country, I should say Government of India, the public of India, the same way Government of Assam and each and every citizen of Assam had been contributing to the fight against COVID, and the resilience shown by health department is really commendable as well. But at the same time, when this vaccine comes, this vaccine is not offering immunity from the day of vaccination.
Yes.
At present, the idea is that the 2 doses would be approximately 4 weeks apart, and after almost 2 weeks from the second dose. So let us say vaccination today, another 28 days for the second dose, and another 14 days from the second dose. So almost 42 days is expected before the person who is inoculated will develop comparatively absolute immunity against the disease. So till that date, there is obviously a chance, a possibility of getting an infection.
In a layman's word, let me tell the viewers, in a layman's word, because I am a layman as far as this issue is concerned, you take the vaccine dose 1, then after 4 weeks you take the dose 2, and after roughly about 15 days after taking the second dose, only after that immunity or antibodies are going to be created. Therefore, even if you take the first shot, you might run the risk of getting the virus. Is that correct, Dr. Lakshmanan?
Exactly.
Okay.
In common parlance, that is the right meaning.
Absolutely. I'm coming to you, Dr. Achyut Baishya, but quickly, since Dr. Lakshmanan has talked about the new strains in the United Kingdom, Dr. Jayanta Sharma, what is the feedback from the medical fraternity, particularly the biotechnologists who are developing the vaccine? You know, the new strains, are the vaccines capable of dealing with the new strains which have just emerged?
Okay, as far as this particular new strain in United Kingdom and Africa were concerned, the vaccine would be efficacious. I think that has been more or less quite confidently been said by the scientists. So we can be rest assured about that. But having said that, we have to be quite vigilant. You know, the virus is mutating all the time, and mutation in virus is not a big deal. This COVID virus has mutated probably over 50,000 times by now. And this particular mutant, which has acquired 17 mutation, is extraordinary in the sense that it managed to acquire so many mutations in one go, which is, again, there are theories why, you know, it could manage to do so. But having said that we cannot be less vigilant. The mutant strain, vaccine escape strain may arise at any time.
Right. Absolutely. Dr. Achyut Baishya, since you are here today in this panel, Dr. Lakshmanan is here. I have got to ask a very critical question which a lot of people would like to know. You see, you have dealt with the COVID, you have never faced, nobody thought that there will be a pandemic like COVID in our lifetime and we'll have to face, but we have been able to overcome almost, we have been able to deal with the situation out of scratch, devising different kinds of strategies. Now my question is, Assam, you have already been lauded by none other than Union Home Minister Amit Shah, who said that Assam government had tackled COVID in a fantastic way. This has been acknowledged by the central government. Now the question is, as someone who is a leading figure in the medical fraternity, Dr. Lakshmanan is also here as far as the policy making is concerned. My question is simple. Is the Assam government planning to have more research and development facilities, because research is just not a very huge component as far as Assam's health infrastructure, if I may loosely use the word, is concerned?
Definitely, it's a big, good question, because I'm fortunate that I was working with Dr. Lakshmanan during when the COVID started, and both of us started from the February itself. And when people went from the office, we both of us sat together. And Dr. Lakshmanan wrote an essay that what will be the COVID situation in Assam. And both of us predicted that in Assam, the case will go 1 lakh, 2 lakhs, 3 lakhs. And how to tackle, then he was asking me the question, sir, how to tackle this, how the extra bed will come. So that was the day in February, or just beginning of the March. Then from that day, we started expanding our infrastructure. Yeah. And we are fortunate that our Honorable Health Minister, with his leadership, with his active participation of the expanding the infrastructure, expanding the manpower, expanding the logistics, so we could tackle it. And now this, as you are asking this, how people are reluctant or something, and after getting the first dose, then we are tackling COVID and COVID vaccine. But in the meantime, we should not forget that our hospitals are also tackling the normal patients, which was stuck down during this COVID pandemic. And for that, today we are having the this rush of people in our hospital. When the winter season, the OPD was around 700, 800. Now it is 1200 to 1400 per day.
Because there are other patients
are coming. So this, as Sir has rightly said, that vaccine will definitely give this protection, as well as a belief to the people that because why the people are coming to the hospital now? Because they are thinking that we are not getting infection. And today, just I am giving an example, I visited some of the places. Then I have never seen a mask except my and my daughter. So this is a behavior of the people. So people are thinking in one bus you will see that the bus is full. That means people are not using
So
mask.
what you're basically saying is that a caution has to remain.
Caution has to
People
remain.
have to be careful in the days ahead.
And our health department.
Complacency should not be there.
Yeah.
Now, sorry if I'm cutting you short. That is only because of the time constraint. Dr. Lakshmanan, I'm coming back to my question. Any plan by the Assam government to focus on medical research and development (R&D)? Do you have any plans? Are you thinking, even if it is in a preliminary stage, is it one of the items being discussed by the Assam health authorities?
Absolutely, because in the last 1 year, one particular point which we all learned from COVID is that absolutely there is a need for research and self-improvement through the learning points from the research. Government of Assam, even during the COVID pandemic, under the leadership of Dr. Achyut Baishya here, also with the support of Shankardev University, Health University, the Community Medicine Department of GMCH and also AMCH had undertaken various studies. Not only that, if you see, we have a good institution RMRC in Dibrugarh, Lahowal, who has been helping us throughout the COVID pandemic period, whether it is being tests as well as the related researches. In fact, the COVID genome, the COVID virus genome, RMRC Dibrugarh actually decoded this genome way back, maybe in the month of May, when the whole country was just still preparing on how to face this virus. So we can be very, very proud as the part of the country from where we have been giving absolutely due importance to research. But again, this is an ongoing thing. It is not that it will just stop with this.
I want to add here. In one of the our laboratory, VRDL laboratory, is the second laboratory with RMRC from the beginning. On 8th of the February, we started the RMRC. This is our Guwahati Medical College laboratory, and in our laboratory, this sequencing, genomic sequencing has been. Now we got the approval of the ICMR also.
One particular point where I would just add to this thing. At one point of time in the whole Northeast, we had one lab.
Yeah.
Now in Guwahati, under Guwahati Medical College, we have 4 labs.
4 labs.
4 labs.
Yeah.
So
from
all these
one lab in the entire Northeast to 4 labs in Guwahati
GMCH.
Medical College itself. I think that's a huge leap.
Absolutely.
Now, Dr. Madhumita P. Das, you have been teaching, you have been practicing, you have been teaching, you have been treating for many years now. My question is, do you think, at the Guwahati Medical College itself should take the lead, or maybe under an university, there has to be specific research and development programs, because we are always saying that Northeast is underdeveloped, we don't have industries. Don't you think today this epidemic has also, the pandemic has also taught us that we can have a major healthcare industry, medical industry in the entire Northeastern region if the government gives the necessary push? I'm coming to you, Dr. Jayanta Sharma, with a related question. Yes, Dr. Madhumita.
Yes, Wasbir. I honestly feel that yes, Guwahati Medical College under the Shankardev University can take a lead, but all other medical colleges also have very competent faculty members. We should not forget that every single medical college, including the new medical colleges that we have, Tejpur, Jorhat, Borpeta, everyone can contribute, provided we have a proper protocol, a proper guidance, enough of fund, infrastructure. There's a lot of research that we can do. One major thing that has been striking my mind, and I'm sure must be striking the mind of many other people, is we are heading for the vaccination. We're going to vaccinate people on day 1 and day 28. But how long is this immunity going to last?
That is the question. I want to, how long is the immunity going to last? I will ask you this question a little later. Jayanta Sharma, how long is this immunity going to last? Suppose a person has already taken 2 shots, the 2 required shots or 2 mandatory shots. Okay, he has developed the antibodies, but how long?
You can only say at this moment that probably up to 6 months. We don't know about long-term immunity, and probably immunity would wane. There is no question about that. But there's a good thing though. It is not all about antibodies. Something called T-cell mediated immunity as well, which cannot be directly measured as we measure in antibody level. It is difficult to measure in that sense. But we remain assured there is something called T-cell mediated immunity, and that is usually long-lasting. But sheer level of antibody probably would decline beyond 6 months. And about this vaccine, while we are commending the scientific community of coming up with vaccines in record time. I think that was not the, I would not comment anybody or myself or anybody for that, because given the technology we have today, it is possible. That is why we got the vaccines. But what is impossible without actually waiting waiting sufficient amount of time? The questions like this: is this immunity going to be long lasting?
Yeah.
And you need time to answer that sort of question. So there are many
the last,
perspectives.
absolutely.
Things are not as black and white as we project it is to be. And for example, immunity not on a particular day, on day 28 or day 24,
Yeah.
immunity suddenly appears. It is not like that. Even after the first shot of vaccine, you would start developing antibody. Within days, within couple of weeks. There is not that on day 28 magic would happen and you would get antibody. It is not like that. Therefore, in the United Kingdom, if you know, it is a very interesting thing. They are giving the second dose after 3 months. Because first dose itself provides sufficient immunity. That is what UK scientists are telling. UK government is taking
that's
that
a very
view,
interesting
and the
way
second
of-
dose is given after 3 months.
So the basic
So
idea
that is to
perhaps,
actually allow,
the basic
that is
idea,
to allow as many people
yeah,
as we can,
the basic
with the first dose.
the basic idea perhaps being to increase the time of coverage, the time, the range.
Increase the
coverage.
population coverage, yeah.
Absolutely.
That is what UK took. That approach
right.
UK took because given the situation here.
Right. I would like to ask a few more last minute logistic issues, but before that, Dr. Madhumita, the same question goes to you. Do you agree with what Dr. Jayanta Biswa Sharma said, or do you think the coverage, the time span? A lot of people asking, you yourself asked this question. A lot of people would like to know another view as to how long will this immunity last. Suppose you take 2 shots of the vaccines.
That's absolutely not clear, if you're asking me. None of us know how long the immunity is going to last, because we know about the influenza vaccine. That's given once a year. Every person takes it once a year, and that's supposed to protect you for 1 year. The pneumonia vaccine, it's for 5 years. But all this has evolved over a period of a decade or so of research, but this has been a fast track. The fact that the vaccine has been developed in 10 months, which would have otherwise maybe taken 10 years, is a huge feat in itself. And the rest of it, I think, will evolve over time as we handle the situation and we see the cases coming up over the years.
Now, Dr. Lakshmanan, another very interesting question which a lot of people want to know. Let me take this opportunity of your presence here. Assam has a population of 3.5 crore. Now, the question is, how long will it take for the entire population to be vaccinated? 6 months, 1 year? What is your estimate? You must have worked out something. You must have have a guess.
See, if we see the whole big picture in one shot, it is probably a situation where we will come up with varying numbers, each of them wrong. What I would suggest is that this is particularly a situation when we have to plan phase wise. Let us divide our targets, be really focused on what we want to achieve. And at this point of time, I would definitely mention that the healthcare workers who are working immediately with the COVID positive patients are our target. And at present, we have about 1.7 to 2 lakh people who we are preparing to get vaccinated in the next 1 month or so. So definitely over a period of time, this 3.5 crore people with different categories, frontline workers, then subsequently above 50, then subsequently less than 50. Over a period of time, definitely we will be able to cover majority population, and as earlier mentioned by Dr. Das and Dr. Sharma sir, we would be getting the benefits of herd immunity as well during the whole vaccination process itself.
Yes. The point which is emerging is that about 2 lakh people in Assam will be likely to be vaccinated in the first 1 month. Starting from 16th of January, and these 2 lakh people are basically the frontline healthcare workers. So that is what Dr. Lakshmanan, the mission director of the National Health Mission Assam, is saying. Final comments from you, Dr. Asudwasya. What do you see? How is this rollout going to happen? 20,000 people being involved in the process, about 9,000 vaccinators themselves plus supervisors and all, total about 20,000 people who must have already undergone training. because training the trainers had already taken place centrally, and now these people are trained. So this is a huge exercise, isn't it?
Definitely, it's a huge exercise.
And nothing can go wrong.
No, but one thing, this whatever the people are being trained, they are already trained earlier also on vaccine, because they know what is cold chain, they know what is vaccine MIS, and they know how to these vaccinators know how to do the vaccination. So this is most of them are experienced, and we are optimistic that whatever the large volume, because now the benefit is that we are having this earlier the units were in Assam 27. Now we have got a 33 districts. On these 33 districts, we have got a logistics distributed, we have got the manpower distributed, and the meticulous planning from the session sites to the districts, because already the sequencing has been done. It is vaccine will reach district, from the it will go to the CHC or PHC, and this vaccination particularly will not go to sub-center, because every session site will have some space for the waiting area, and after the vaccination of the 100 people or 200 people, whatever the beneficiaries will come, so we have to make them wait for half an hour. So
that is what I wanted to know.
So that is a meticulous planning, and this like the election booths and other things that everybody visits. So in these session sites also it will be visited, it will be cross-checked, it will be checklist prepared, and accordingly only after that all verification is perfect, then only it will be allowed that yes, this session site is agreed. So with this meticulous planning,
elaborate plan already in place. Final comments from you, Dr. Madhumita, 20 seconds.
I would say that this is going to be a huge achievement for the country. We have to be optimistic. We don't have to have any undue fear, but never forget to give up on your personal protection up until a couple of months or maybe a year, till COVID is actually no more causing a havoc in the society.
Vaccine is optimistic, but don't lower your guard is what Dr. Madhumita is saying. Final comments from you, Dr. Jayanta Biswa Sharma. 20 seconds to you. A view from the UK. How do you see?
Okay, I mean, for me, glass is half full as far as COVID is concerned. We are getting 12 times more cases than in April last year, but we are not getting 12 times more hospitalization. Hospitalization number are more or less staying the same, little more. So COVID is causing lot of infection, but not diseases. So that is a very good sign. And COVID is a seasonal disease. It is going to come back to India in May, June time, because that is the time influenza, respiratory diseases, we see the prevalence going up in tropical country like India. And for USA, for United Kingdom, for Europe, it is going to be the life, routine affair. Every winter comes. We have to prepare ourselves. That is
very interesting situation there. Analysis in the United Kingdom. Dr. Jayanta Biswa Sharma saying COVID cases have risen 12 times, but the hospitalization, the rate of number of hospitalization remains the same as it used to be earlier in the initial stages. That is a very interesting scenario, really. Last word to you, Dr. Lakshmanan. All geared up?
Yes, we are looking forward, and we are really confident that along the whole country, Assam would be definitely going forward for vaccination.
Absolutely. It is because of this confidence that the 3.5 crore people of Assam were able to face the pandemic in the last 10 months. The confidence shown by the state government, the confidence shown by the Assam Health Department is one of the major reasons why Assam and the people of Assam could face this pandemic bravely. Of course, the people have also contributed. We cannot deny that fact. This has been a very engaging discussion. I thank all my panelists for sparing time, basically in public interest, to come to this discussion today. And I thank all the viewers for watching the program. Good night and goodbye.